One of the other things that I noticed that earlier today, which Heart and Health does, is another thing that's at epidemic proportions right now, which is diabetes. And we had spoke on other programs about that. I was able to interview one of your diabetic counselors earlier today, and we have some footage of that. And we'll be right back in just a moment after that footage.
Thank you.
You've been watching Heart and Health. Please feel free to visit our website at heartandhealth.com. Heart and Health, where prevention and early detection are the hallmarks of 21st century medical care in the United States. Heart and Health is a multi-specialty care facility in family medicine and cardiology, specializing in latest technologies in detection of early stage of diabetes and heart disease in 2 locations in the heart of Long Island, Babylon, and Middle Island. Heart and Health is clinically affiliated with Mount Sinai Hospital in New York City.
We're with Maria Rodriguez from Heart and Health. She's a diabetic counselor. We had a few questions for her. What exactly is diabetic counseling?
Okay, so I want to state that diabetic counseling is coming to see a registered dietitian or a registered nurse who is certified diabetes educator. When we come together with our patient, our focus is to become a motivator, a listener. It's really interactive, but I always want the patient to be able to express themselves and tell me what their struggles have been with diabetes. Patient may be newly diagnosed diabetic or in the pre-metabolic syndrome, which is pre-diabetes. There's a lot of myths that patients have that need to be clarified. And so we're touching on a lot of sensitive I would say issues that sometimes patients come to see me, and as a listener, it's really the key fact that I need to find out how can I motivate this patient and bring value to their self-management so they become more adherent.
So there's a little bit of detective work.
It is for both me and the patient. I always tell the patient it's their diabetes, that I want them to feel empowered. I want them to feel that they can go home and start, even through blood sugar testing, detect when in the day we need to address more medication or exercise, or when in the day we can alter or adjust medications again. Because your blood sugar is always fluctuating. It's never the same number. It changes at all moments of your day. So a patient needs to learn their blood sugar goals, the importance of testing the blood sugar, how food brings a relationship to that blood sugar. So testing after meals is really a key factor as well.
Is diabetic counseling strictly about diet, or is there a lot more to it?
When we think about diabetes, we think about diabetes as being cardiovascular disease. So it's not just blood sugar that we're focusing on. We think of a diabetic person as a whole person. So we're thinking of their eyes, their kidneys, their heart, their feet. We also want to touch on nutrition and what they're currently eating, because we manage diabetes with diet, with medication, and exercise. So there are 3 components that are equally important for a patient to understand when they come to see me, that we will work together on building some sort of gradual, successful plan that fits their needs and their lifestyle.
Maria, what is weight management coaching? Is that different? Is that a new thing?
When we think of weight management coaching, we are truly like motivational interviewing. We are trying to find ways that we can help a patient achieve successful weight loss, permanent weight loss if possible, ways that they can start modifying food choices. How can we get this patient to practice healthier lifestyle? By that I mean like going over a 24-hour recall or practices this patient has, ways that they can promote gradual weight loss, successful weight loss that they can maintain, that could also lead them to prevent cardiovascular disease, hypertension. So weight management is truly just working one-on-one on how can I facilitate successful dietary changes.
Now, with diabetes and these other diets, how really important is exercise?
Exercise is a critical component to diabetes. Sometimes when patients don't exercise, that can lead them to increased weight gain. When a patient is, let's say, pre-metabolic syndrome or pre-diabetic, they have insulin resistance, and so their body's not utilizing the insulin they're producing. Through exercise and some modest weight loss, their bodies start working more efficiently for them. So exercise is important. The recommendation right now that I educate patients, and it's the American Heart Association recommendation, is to build on 150 minutes a week of physical activity, simply 30 minutes a day. It could be just walking if that's the only thing a patient can actually incorporate into their daily activity. They do have like pedometers patients can wear to track their steps from day to day, with the goal of about 5 miles per day. And that's a great tool that patients can use also to kind of motivate them to be more active, to even know what they're actually doing during the day. Sometimes patients will say, oh, 10,000 steps is really nothing, but when they start tracking them on a meter, they realize it's really more difficult than they think.
Now, one thing that most diabetics know that other people who are not diabetic may not know has to do with foot care and other parts of the body. How important is that?
Okay, so as I previously stated, diabetes is a cardiovascular disease. So if a patient has diabetes, they're at risk for increased cardiovascular episodes, as well as hypertension, cholesterol. This can lead to lower extremity changes in terms of peripheral vascular disease. We have changes in circulation, sensation. So when we have diabetes for a prolonged period of time or have hypertension, that can lead them to loss of sensation on their calves, on their feet, and can lead to foot injuries. So foot care is really important. It's definitely one of the things that I always review with my patients at our visits. We do foot care and foot exams. We teach patients how to wear appropriate footwear and how to always dry between toes to prevent moisture and fungal growth, wear cotton socks, now walk around the house barefoot. Before dressing and after dressing, always inspecting their feet for visible changes of the skin or breaks of the skin. So it's really important that patients with diabetes daily do a foot exam, a foot check, to make sure there's no changes from day to day. Because the patient might come to your office today and within days can develop a change in, let's say, a wound that just developed from an inappropriate shoe that they wore, or and they don't feel it. So these things have to be addressed, that starting early on in their management, that they learn the importance of foot care throughout their life with diabetes.
So Maria, if somebody is having problems with their diet or possibly pre-diabetic or already diabetic, what can they do? Can they come and see you? Or
Sure. At Heart and Health, we have services for nutrition counseling, diabetes educator, which would be myself, and patients are more than welcome to come visit me at Heart and Health. They can call and make an appointment and receive a referral, and I am able to visit with them as often as they need to. Sometimes in the beginning, we can see each other more often, and then as the patient starts learning and improves, what they're doing, we can visit each other even like every 3 months. But yeah, Heart and Health is a great place for them to come forward to start what is diabetes self-management, learning, teaching.
And it was a very interesting interview with her, and it's just amazing diabetes, how out of control it is between kids, adults, basically everybody. It is at epidemic proportions right now. And you have that diabetic counselor on your staff at Heart and Health?
Yes, I've been fortunate enough to be able to work with Mount Sinai Hospital and have a nurse practitioner who specializes in diabetes, because I believe my responsibility as a physician is not only to treat the patients with medications and treat them for diseases, but my responsibility is also to educate the patients and help them to understand the disease and help them to come up with a plan, a unique plan for each individual to help them. This plan, the diabetic education program that we have in Heart and Health, so as Lyme disease support that we have in Heart and Health, every Wednesday, once a month, we have the support group that we all get together and we help patients to understand and help them psychologically and also understand the disease. Help us to help the patients to come up with a plan that helps them to lose weight, to control their diabetes, and at the same time educate them. So if they see their neighbors, their family members having the same similar signs or symptoms, or they can't control their blood sugar because of diabetes and overweight, they can give them some advice and help the community the same way that we want to help the community.
And it's a service, again, that Heart and Health offers. Do you have any more comments about that?
Our goal, or my goal as a founder of Heart and Health, is to educate my patients along with treating them at the same time. I think it's a very important part of treating patients in 21st century, to educate them, to let them know what's out there, what treatments and what medical options are out there. I also would like to add to what I was, our goal is early detection, using the best technology and newest discoveries to help patient understand and treat the disease. We look at it as a team. We are a team of doctors, nurses, nurse practitioners, and nurse educators along with the patients. Patients are a big part of our progress in treating the disease and helping the community. So it's important for us to come up with a unique plan that helps every patient individually according to their wish, and try to help the community as any doctor would love to.
Well, we've been with Dr. David Kavesteen from Heart and Health. If you have any more questions or would like more information about what we discussed here on this program, please go to heartandhealth.com. You will find a bunch of information there about Lyme disease, diabetic counseling, and your heart, and a whole bunch of things that are health-related material that will help you understand your health and your heart. Until then, I'm Larry Mike Render for Heart and Health. Take care.
You've been watching Heart and Health. Please feel free to visit our website at heartandhealth.com. Heart and Health, where prevention and early detection are the hallmarks of 21st century medical care in the United States. Heart and Health is a multi-specialty care facility in family medicine and cardiology, specializing in latest technologies in detection of early stage of diabetes and heart disease, in 2 locations in the heart of Long Island, Babylon, and Middle Island. Heart and Health is clinically affiliated with Mount Sinai Hospital in New York City. Thank you for watching.